Dr. Richard Buckley here and team. This morning's project is brachioplasty, which means to trim the excess skin of the upper arm. And sometimes people come, like often enough, and complain of the fat on their upper arms, maybe bat wings on their upper arms, and sometimes there's a lot of swinging, hanging skin. So it's easy enough to get the fat out. We can certainly do laser along with that to get some additional tightening and sculpting. Sometimes though, it's a very good idea to remove some extra skin. That's the brachioplasty part, like abdominoplasty. This is a brachioplasty. It's kind of like an arm tuck. And that's what the project is today. So I have put some numbing fluid in this arm with my little device here. Are patients awake? You awake?
I am.
Totally comfortable?
Comfortable, very.
You always take a risk in asking people that you heard comfortable, very.
Very comfortable.
It's a little bit like totally. Is that like totally?
Totally.
Totally. Totally, very comfortable. So that's quite comfortable. Quite, very, totally comfortable. Okay. Yeah, and laughing. And awake. It's very healthy awake. It's much safer awake. So everything we do is awake. Eyelid surgery, face neck lift surgery, breast augmentation, tummy tucks, arm tucks, brachioplasty. Today's project. So I'm going to suck some fat out of here, and also on this little bit here and here on the arms. You know, we know where fat likes to hide. It's not going to hide from us. We're going to go get it. And we get that out of there, sculpt it out of there, micro sculpt it out of there. Micro means with tiny little fine tools, so we just use small little entry points. There's, by the way, a little entry point there. You don't even see it. You can see the little circle I drew around where the entry point is, but I don't think you could see my entry point. I really can't see my entry point, but I know there's one there. So if I take this little tool and do that and push it in, you can see, number one, our patient's comfortable. Number two, yep, indeed, there was a little entry point there. So I can go in there and suck that fat out in just a moment. I'll do that. Nice to have show and tell. That's fun. As soon as we have finished with our sucking out of the fat, and by the way, the fat we suck out is alive, and on today's adventure, we're going to reutilize some portion of it. We're going to do AFT, that is autologous fat transfer. That means auto, it's yourself fat transfer. It's not fat from somebody else. People want to share all the time. Can I give my fat to somebody else? No, I don't do that. It's got to be your own fat. And what happens if you don't have fat? Yeah, you got a problem. We have to do something else then. We have to use some synthetic fillers, some Restylane, or something to stimulate your own collagen, such as sculpted, polylactic acid, PLLA, etc., etc. So anyway, we're going to take some of the living fat cells we take out of the arm here today and use it to help re-sculpt and rebuild our patient's face and also the back of her hands, both of which show volumetric changes with aging. That is to say, the volume goes down, things sink in, things shrink, they sag, a whole world of things that we can help reverse. First step is to, of course, figure out what we're doing, draw things, make a map. This part that you see right here, that's actually the part I'm going to excise in a little while. These little blue dots here are more the borders of what I'm going to do some liposuctioning on here forthwith. Also, prior to actually taking this skin out, and you'll know this from watching prior episodes of MilfordMD, where we showed you maybe a tummy tuck, for example, and tailor tacking. I will use these small little towel clamps and take this skin that's here and make sure that it's going to move itself all the way over to there and enable the skin to go back together again nicely. It won't at the moment because it's poofed up with the numbing solution. But I trust it will in a little while. It always has, but I always make sure that what I've drawn is the actual good amount to be taking out. Make sense? Hope so. So maybe we'll call you back and show you some more bits of today's puzzle. That's brachioplasty, both arms, right and left. And by the way, you know, I've measured them. I made an arbitrary point here. I came in 12 centimeters, and then I put measuring tape around the arm and noted the fact of what appeared to be the case. To me, it appeared that the right arm was bigger in circumference than the left. And it is, by about 1.5 centimeters, as measured at that point that I just mentioned. We'll try to bring some symmetry to that. In other words, take out a little more fat on this side. right? So thank you for watching another episode of Milford